Hi, I'm Simone and welcome to my channel. Insulin is a hormone produced by the pancreas that has the task of regulating the level of glucose in the blood. Glucose is the main source of energy for the body's cells and comes from the foods we ingest, especially carbohydrates. When we eat, glucose enters the bloodstream and insulin is released to facilitate its absorption by cells. Remember, if you like this content, to like the video and subscribe to the YouTube channel to support me and not miss all the news that will come out. Insulin therefore has beneficial effects on the body, as it allows you to maintain the right balance between glucose and insulin in the blood, avoiding both hyperglycemia, excess glucose, and hypoglycemia, glucose deficiency. Hyperglycemia can cause damage to various organs and tissues, such as the heart, kidneys, nerves, and retina. Hypoglycemia, on the other hand, can cause symptoms such as weakness, tremors, sweating, confusion, and loss of consciousness. Insulin also has other effects on the body, such as stimulating protein and fat synthesis, inhibiting tissue degradation, and promoting cell growth and repair. Furthermore, insulin plays an important role in the metabolism of mineral salts, in particular potassium, magnesium, and phosphorus. However, in some pathological conditions, such as diabetes mellitus, the production or use of insulin may be altered, causing a dysfunction of glucose metabolism. Diabetes mellitus is divided into two main types, type 1 and type 2. In type 1, the pancreas no longer produces insulin due to autoimmune destruction of the beta cells that secrete it. In type 2, however, the body's cells become resistant to the action of insulin, making it ineffective. In both cases, the result is a chronic increase in blood glucose levels, hyperglycemia. To treat diabetes mellitus, it is necessary to administer exogenous insulin, i.e., from sources outside the body, through subcutaneous injections or infusion pumps. Exogenous insulin is intended to replace missing or insufficient insulin in the body and restore normal glucose metabolism. However, exogenous insulin can also have unwanted side effects, such as hypoglycemia, if administered in excessive doses or not adequately balanced with nutrition and physical activity, weight gain, due to the greater availability of glucose for the fat cells, allergic reactions, rare but possible, and lipodystrophy, alteration of the distribution of subcutaneous fats at the injection site. To avoid or reduce these side effects, it is important to follow a personalized insulin therapy monitored by the diabetologist, which takes into account the individual characteristics of the patient, age, weight, lifestyle, other associated pathologies, and the type of insulin used, rapid, intermediate, or slow. Furthermore, it is essential to follow a balanced and healthy diet, rich in fiber and low in simple sugars and saturated fats, and to regularly practice moderate but constant physical activity. Insulin and impacts on training. Insulin is a hormone produced by the pancreas that regulates the metabolism of carbohydrates and fats. Insulin plays a key role in the absorption of glucose, sugar, from cells, which serves as a source of energy for the body. Insulin also affects fat storage and protein synthesis, two processes important to health and fitness. Physical training has significant effects on insulin action and blood sugar control. In general, training increases insulin sensitivity, that is, the ability of cells to respond to the hormone and use glucose. This means that the body needs less insulin to keep blood sugar levels within normal limits. Training can have different effects on insulin depending on the type, intensity, duration, and frequency of exercise. Some types of training, such as aerobic training, running, cycling, swimming, etc., reduce insulin levels in the blood during and after exercise, because they increase the consumption of glucose by the muscles. Other types of training, such as anaerobic training, weights, sprints, jumping, etc., can increase blood insulin levels during exercise, because they stimulate the release of glucose from the liver. However, both types of training improve insulin sensitivity in the long term if practiced regularly. Insulin training requires careful planning and constant monitoring of blood sugar levels. The goal is to avoid both hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, which can have negative consequences on your health and performance. Hypoglycemia can cause symptoms such as weakness, tremors, sweating, confusion, palpitations, and loss of consciousness. Hyperglycemia can cause symptoms such as thirst, frequent urination, fatigue, nausea, blurred vision, and ketoacidosis, buildup of acids in the blood. To prevent these complications, it is necessary to adapt the dose and timing of insulin injection based on the type and intensity of training. In general, it is recommended to reduce the insulin dose before aerobic exercise and increase it before anaerobic exercise. Furthermore, it is recommended to measure blood sugar levels before, during, and after exercise and to consume carbohydrates if necessary to keep the values within the desired limits. Insulin training can be a challenge, but also an opportunity to improve your quality of life and physical and mental well-being. With good education, proper management and medical supervision, you can practice any type of exercise safely and effectively.